Hi guys, I'm back. So how important do you think teamwork is in nursing? Personally, I think it's one of the top 3 things that makes working on a specific nursing unit such a great place to work. We all have to help each other out sometimes. Nursing is not a one-man team and it never will be. There will always be questions that we have working in new places or situations that we haven't dealt with before and we may need somebody's help. Like if a patient's jumping out of bed, we may need somebody to help us put them back to bed safely or reposition them, or we need another nurse to co-sign insulin or heparin. I've worked in about 15 different hospitals, and I used to work for an agency where I would get placed in different hospitals like every shift. And I had hospitals that I really liked going to and then ones that I really didn't care to go to. And the ones that I disliked were the ones that I felt didn't have any teamwork in nursing. Like the nurses weren't that friendly and they didn't want to help anyone but themselves. Maybe they have it all under control and they don't need anybody's help. Well, kudos to them, but I doubt that's the case. So after 3 years of doing agency nursing, I decided to sign on as a staff nurse at the hospital of my dreams. So at this hospital, I didn't notice a lot of complaining with the nurses or bad attitudes when someone needed help with something. And for the most part, everyone got along and played nice together. At another hospital I worked at, I had this patient who was confused and trying to get out of bed, and I walked by the room and I saw another nurse sitting in there charting and just kind of keeping him company to calm him down, and I was actually really touched because it's not even her patient. The second thing I think that's really important when working on a nursing unit is positive and supportive management. I've worked with some managers that are kind of condescending and they'll always tell you what you're doing wrong or what you should be doing. So I always appreciate managers that can kind of lift you up and help you to become a better nurse in a positive way instead of tear you down and make you feel like a loser. And the third thing is when a hospital's organized and they do things the right way. I was working at this one hospital that was not on my list of favorites, and I had a patient scheduled for a CT scan and he wasn't ready because I needed to put another IV in him, and they came and took the patient away without me knowing. And then they were like upset because he didn't have an IV, and I was like, well, maybe if you would have called me, I could have told you that the patient wasn't ready. That's just unacceptable. You can't take my patient without me knowing about it. And I know sometimes we can't be choosy with jobs, but those are just the top 3 things that I think makes a job a great place to work. And most importantly, always remember to help your fellow colleagues out, because someday, if not every shift, you're going to need help with something too. Well guys, thanks for watching. Talk to you soon, okay? Bye!